Welcome to this webinar. My name is Stephanie, and today's topic is about addressing constraints to communication. The knowledge and skills on how to address constraints to communication are essential to maintain a collaborative relationship. This applies not just to colleagues, but to other relevant people as well. Constraints refer to limits or restrictions that stop something from happening. The presence of constraints hinders a smooth flow of communication. Identifying signs of potential conflict and report according to organisational procedures. Before actual constraints arise, you will be observing early signs of potentially tricky situations in the service. These early signs must be identified for them to be addressed and immediately. Reporting is essential and helps in different purposes. Cascading such incidents to the supervisor prevents them from worsening. The supervisor can be able to provide advice that may help both parties in resolving the situation. Identifying signs of potential conflict. So potential signs could be emotional outbursts. This refers to the sudden outpouring of the emotion of the people you're talking to. This involves anger, overreaction, or when they become hysterical. Unusual body language. Another early sign of potentially tricky situation is when a person displays unusual body language. This involves their facial expressions and the way they express themselves. Behavioural changes in their usual behaviour also indicate that something is not right. This involves displaying different actions or attitude that is out of their typical character. Choice of words. You'll notice an early sign of potential conflict based on the words that they are using. Often their use of words becomes emotive when they are feeling upset or disappointed. Complaints. Another indicator is when people are raising a lot of complaints. It can either be complaints about the service, their work role, requests, or anything relevant to the service. Complaints may be either be received in face-to-face encounters or through surveys that have been conducted. Reporting according to organisational procedures. So early signs of potential complications or challenging situations must be addressed immediately. Doing this will help to prevent these conflicts from arising and from worsening. Negotiations must be done to avoid such conflicts from occurring. If you notice a need for immediate action or assistance from appropriate people, then that is the time to consider reporting. Reporting is one of the ways that must be done upon encountering early signs of potential conflicts in the workplace. So some steps to consider when reporting potential disputes are all concerns and incidents must be reported to their supervisor for identification, to control and prevent them, and attend to potential conflicts immediately. Signs of potentially complicated situations do not just occur within the workplace. They must be immediately reported through a phone call to the workplace supervisor. So when reporting potential disputes, you need to think about all reports must be documented using the forms and templates being used in the service that you're working with to serve as evidence of or supporting documents in case actual conflicts arise within the service. Forms and templates must be completed within 24 hours and must be submitted to the supervisor upon completion. Identifying communications constraints and resolve using communication strategies and techniques. There are many possible constraints to communication. These constraints must be resolved for effective communication to take place. When constraints are resolved, messages can be clearly and accurately conveyed, and the communication process becomes smooth sailing that will save time and resources. Resolving constraints can be done by using and selecting the appropriate communication strategies and techniques. There are many possible constraints to communication. These constraints must be resolved for effective communication to take place. When constraints are resolved, messages can be clearly and accurately conveyed, and the communication process becomes smooth sailing that will save time and resources. Resolving restraints can be done by using and selecting the appropriate communication strategies and techniques. So identify communication constraints. Constraints to effective communication affect the clarity and the delivery of information. When communication is not smooth, it might result in conflicts and disagreements. Some of the most common constraints to effective communication are external noise. This refers to unnecessary sounds that interrupt effective communication. This may result in misunderstanding or misinterpretation. Differing perceptions. Constraint arises when two or more people argue due to having varying thoughts and ideas. This may also occur when there is a need for suggestions or opinions. Varying abilities. Community and health services often have diverse members and employees with varying abilities, disabilities, additional needs, or special needs. Absence of non-verbal cues. Non-verbal cues are essential when conveying a message to other people, but this can be a challenge when communicating via phone calls, text messages, or emails. Cultural differences. Each person has a different culture, having their personal beliefs as well as their languages. Psychological state. Psychological state such as stress, anger, and disappointment can impact communication. Attitude towards situations. This refers to the attitude of the people towards the problem they encounter. This involves a lack of motivation toward work or resistance to change. A person who lacks motivation and resists change is usually closed-minded and limited to their opinions. So communication strategies and techniques. Constraints to effective communication must be resolved immediately. This is done by sharing or gathering information clearly and smoothly to avoid wasting time and resources. To address constraints to effective communication, you must consider the following. So communication strategies refer to the ideas that must be considered to resolve constraints to communication. These strategies are turning to decisions or putting everything to action. Some communication strategies can be used to settle constraints in communication are staying in a peaceful environment when communicating with different people, focusing on the information and not on the person you're talking to, communicating with people in a timely manner, be consistent with the use of positive language, utilize different means of communication in facilitating information, keeping instructions clear and concise, broaden your knowledge and understanding of different situations, value and respect other people's thoughts and ideas, be aware with the use of non-verbal cues, and always consider inclusivity and diversity. Communication techniques refer to the ways of sharing or gathering information. These require specific skills for each of them to be utilized effectively. Each technique is appropriate for different situations to resolve constraints to effective communication. So some communication techniques are open-ended questions. They refer to questions that are answered by yes or no. They require responses to explain thoughts and ideas further. Affirmations, they refer to positive statements that can help in conquering negativities. This helps in having a positive mindset towards different situations. Reflections, reflection is done to clarify your understanding of what other people have said. It is important to reflect for both of you are both on the same track. There are two main techniques in reflecting. Mirroring, this refers to the form of reflecting where you exactly repeat what has been said. Paraphrasing refers to the use of relevant words to reflect what have been said. Summaries, this is one of the most critical skills for effective communication. This refers to coming up with a brief outline of the necessary points from a conversation, meetings, or workplace document. Motivational interviewing, this refers to an appropriate approach to be used to help people manage uncertain feelings and insecurities. This is done for them to be motivated and exhibiting positive behaviours. A coercive approach, this approach is focused on an individual to change behaviour. It does not recognise the person's ideas and feelings, resulting in resistance and workplace conflicts. Collaboration, this is an approach that is concerned with both parties in a conversation. The goal of this approach is to have a win-win situation. Confrontation. This refers to an approach where you directly tell a person your feelings, emotions, and what you want to happen. So use communication skills to avoid, diffuse, and resolve conflict situations. Communication skills are one of the most essential skills that you should acquire. It would be best to communicate with relevant people in a professional manner. It is important to use communication skills to avoid, diffuse, and resolve conflict scenarios. Avoiding conflict means preventing communication issues when arising. In cases where disputes are already present, these communication skills will diffuse or lighten the situation. The following communication skills will help in avoiding, diffusing, and resolving conflict situations. Active listening. This refers to understanding what other people are saying and not just hearing the words they speak. This can be done by maintaining eye contact with them. It involves displaying nonverbal cues such as nodding, smiling, or saying words of affirmation. Clarity. Information and messages that will be shared and gathered must be clear and straightforward. This helps ensure that the necessary information is shared between service workers, clients, and other relevant people. This is essential to have a clear understanding of the topic. Confidence. When you're confident, it's easier to speak clearly, to articulate your words, to listen and to understand others, and get your message across to people you speak with. Confidence is a character trait that shows you are sure about your words, actions, and decisions, and that's something that people respond to positively. Empathy. The ability to understand and share the feelings of others. Put yourself in their shoes. Smiling and remembering people's names is empathy in action. Giving people your full attention in meetings, being curious about their lives and interests, and offering constructive feedback are empathetic behaviours too. Kindness. This refers to doing good for other people. Kindness can be displayed by being generous, being thoughtful, or being considerate. When you show compassion to other people, there's a high chance for them to cooperate positively. Open-mindedness refers to being flexible in understanding different situations. It involves considering the other person's point of view, even when they are against your own beliefs. Open-mindedness can help you improve your relationships, creativity, and problem-solving skills. What have we learned? In this part of the session, we have covered communicating effectively with people, collaborating with colleagues, addressing constraints to communication. In the future, we will discuss accomplishing workplace correspondence and documentation and contribute to continuous improvement. Log into your tutor's online learning portal and complete the assessment activities. Thank you for your time today, and I trust you have found the information informative. Thank you. Welcome to this webinar. My name is Stephanie, and today's topic is about reporting conflicts. So in this session, you'll gain the knowledge and skills to report problems to your supervisor. Problems within the service must be escalated to them first as they provide the necessary guidance and advice for such issues to be resolved. They will also communicate with relevant people if needed. So comply with legal and ethical responsibilities and discuss difficulties with your supervisor. You must understand the legal and ethical requirements and the organisational policies of the service to help you know the rights of clients that you must uphold and protect. As a health or community service worker, you must take the initiative to review and understand the regulatory and legal requirements, ethical requirements, and organisational policies. It is vital to adhere to such requirements because they provide a basis and standards for quality service and support programs for clients and service members. They allow service members and staff like you to support and uphold their rights. They help create a safe workplace and a healthy environment. They ensure the consistency of processes and structures. They give a fair and objective basis for judgment and decision making. Below are examples of how you can adhere to organisational policies, regulatory and legal requirements when providing services to clients and when working with colleagues. So you need to be knowledgeable of the organisational policies, legal and ethical requirements, be aware of the client's needs and challenges, commit and protect client and employee rights, and uphold clients' rights according to the policies and procedures. Maintain integrity and honesty as an employee and a professional. Communicate to services about the challenges you encounter, and acknowledge mistakes and receive corrections from supervisors. So this will guide you on how to help clients and colleagues to exercise their rights, protect their welfare, and support their needs. Complying with legal responsibilities. Legal responsibilities set the national standards for providing services for clients. These are geared toward the legal considerations concerning health and community services. Legal responsibilities refer to what service workers need to be doing according to the legal requirements. So, legal considerations to include privacy, confidentiality, and disclosure. Collect and use the personal information of clients' service members and other relevant people for service provision purposes. Take responsibility for the misuse of information. Ensure accuracy of the information collected. Provide access to clients' and service members' information. Avoid sharing information with people outside of the organisation. And avoid actions or statements that may ruin the image of the organisation. Discrimination, legal responsibilities. Treat clients, colleagues, service members, and other relevant people equally, regardless of, but are not limited to, race, sex, age, and disability. Uphold the rights of all people, including the clients, service members, employers, and other relevant people. Duty of care. Legal responsibilities are identifying and eliminating possible sources of harm, guiding clients in following safety guidelines, and check all equipment and report any defect which may cause harm to clients. Mandatory reporting legal responsibilities include reporting any sign of, but not limited to, physical abuse, sexual abuse, emotional abuse, neglect, exposure to family violence, and report any violation of rights. Translation, the legal responsibilities are being aware of cultural sensitivities, avoid using idioms, metaphors, and jargon when translating, use plain English when writing documents, consider the language and dialect of the client, adhere to confidentiality requirements. Informed consent, legal responsibility is to inform the clients of the purpose of using the information, ways the information will be used, people who will have access to their data. Do not force the clients to give their consent. Ensure that consent is given by a person capable of giving consent. Answer questions and clarify misunderstandings with the person involved. Collect the written consent of the person, allowing you to use the information. Work role boundaries, legal responsibilities and limitations include performing according to role boundaries depending on the title and level. Avoid performing beyond each worker's responsibilities. This may affect quality service provision. Follow guidelines, policies, and procedures when performing work roles and responsibilities. Child protection and safety. Legal responsibilities are always consider the interests of the child, provide early interventions for the child, encourage children's participation in decision-making processes, report harassment or victimizations. Adult disclosure, the legal responsibilities are providing immediate support and comfort, immediately report cases of abuse and neglect, and follow confidentiality requirements relating to the information that the child may disclose. Complying with ethical responsibilities. The Australian National Code of Conduct for Healthcare Workers are guidelines on values and choices. These influence the decision-making of healthcare workers and professionals. These are regulations that assert specific actions that are identified as appropriate or inappropriate to an employee's role. According to Queensland National Code of Conduct for healthcare workers must provide services safely and ethically. So a healthcare worker must maintain the necessary competence on his or her field of practice, must not provide health care of a type that is outside his or her experience or training, or provide services that he or she is not qualified to provide. Must only prescribe or recommend treatments or appliances that serve the needs of the client. Must recognise the limitations of the treatment he or she can provide and refer clients to other competent health service providers in appropriate circumstances. Must recommend to clients that additional opinions and services must be sought where appropriate. Must assist a client in finding other appropriate healthcare services if required and practicable. Must encourage clients to inform their treating medical practitioner, if any, of the treatments or care being provided. They must have a sound understanding of any possible adverse interactions between the therapies and treatments being provided or prescribed, and any other medications or treatments, whether prescribed or not. That is, he or she is or should be aware that their client is taking or receiving, and advise the client of these interactions. They must provide health services in a manner that is culturally sensitive to the needs of his or her clients. So these ethical responsibilities are the moral obligations expected from health and community service workers. Aside from these responsibilities, there are specific values that each healthcare and community worker must follow. These are according to Australia's public and education sector, which may also apply to public sectors of healthcare. These values are the foundation of ethical behaviour in the public and education sectors of South Australia: democratic values, service, respect and courtesy, honesty and integrity, accountability, and professional conduct standards. Discuss any difficulties with your supervisor. So complying with legal and ethical responsibilities is one of the most important things to do. However, you may experience difficulties in complying with some of these. These may involve difficulties in maintaining patience with difficult and aggressive clients, working with colleagues who may have conflicting interests, and performing a work role beyond the responsibilities given to them. Know your role. It is essential to discuss these difficulties with your supervisor. They may be the ones to help you and guide you on how you can comply with the legal and ethical responsibilities expected from you. So in discussing these difficulties with your supervisor, you need to consider the following actions. So describe your difficulties to your supervisor. Provide a general overview of the problem. Explain how you think these difficulties might affect your work and the service's goals. Suggest solutions or different approaches that you think may help you addressing the difficulties. Explain how these solutions and approaches may benefit you and the service. Listen to your supervisor's advice and guidance. Perform the necessary action to address your difficulties, and take responsibility for the possible outcome. So refer breach or adverse events to relevant people. Working in health and community services involves encountering breaches of standard procedures and adverse events. Standard procedures refer to the prescribed processes by the service. These procedures are based on legal and ethical requirements. Breaches refer to practices that are deemed non-compliant based on legal and ethical requirements. These breaches result from poor implementation of procedures or inconsistencies in the procedures themselves. It is essential to refer breaches and adverse events to appropriate people. They direct the vital steps and processes to resolve the conflicts. They can provide guidance and advice on what needs to be done in situations like these. You must be able to take responsibility for referring upon encountering such problems. So breach or adverse event. Different standard procedures are being followed in health community services. These are brief procedures that service members need to follow while working and communicating with relevant people. Some tasks that need to adhere to standard procedures are communicating service information, exchanging information, using workplace terminologies, following communication protocols, reporting workplace conflicts, and completing workplace documents. Breaches to standard procedures. While working with clients and other people, you'll be noticing breaches to standard procedures. So examples of breaches to standard procedures relating to the tasks mentioned previously: communicating service information. Breaches to standard procedure include one of your colleagues provided private information to potential clients, someone posted an inappropriate video on the service's social media account, exchanging information. Breaches could include the information of a minor was collected without their carer's consent, a patient's confidential information was released to a different patient. Using workplace terminology, breaches could be a report contains terminologies that are not being used in the service. A colleague communicated with potential clients using industry terminologies. Following communication protocols, breaches could be a team leader never conducts a meeting that needs to be done weekly. A manager refuses to include a service member during an organisation-wide conference. Reporting workplace conflicts. Breaches could be a colleague refused to report the incident that happened between them and a client. A service member posted a picture of an accident in the workplace to the personal social media account. Completing workplace documents. Breaches could be a colleague copied and pasted the entire medical history of one patient's record to another. A colleague exchanged the format and style of the workplace's forms that the service is using. Adverse events. Aside from breaches to standards procedures, adverse events must also be referred to appropriate people. An adverse event refers to unexpected harmful occurrences during medical treatment. This may involve incidents related to the therapeutic goods. Therapeutic goods comprise a broad range of medical things. They fall under the three main categories. Medicines. These involve over-the-counter medicines, prescriptions, and vaccines. Medical devices. These involve equipment and instruments being used in medical processes. Other goods. These involve other medical stuff such as blood products and disinfectants. Below are some of the adverse events that may happen within the health and community services. Side effects to medicines and vaccines. These happen when a problem occurs after taking or receiving vaccines. Incidents involving medical devices. These happen when there is a failure in using the medical devices. Near misses. These refer to incidents that might have led to a serious injury or even death. Referring to relevant people. When you're faced with breaches and adverse events, you may refer them to other service members, managers, supervisors, or compliance officers. Relevant people who can help in addressing issues or breaches include employees. They can help in addressing issues or breaches by giving suggestions based on their experiences at work, by raising concerns of possible breaches and adverse events they encounter at work. Your direct supervisor, by giving advice based on previous management experiences, by coordinating with regulatory authorities. Your compliance officer, for providing information and interpretation of compliance requirements. Safe Work Australia, by providing compliance advice related to incidents within the workplace. Therapeutic Goods Administration, by providing advice relating to reporting adverse events upon the usage of therapeutic goods. Fair Work Ombudsman, by providing advice related to employment and employee management practices. Health and Community Services Legal Professionals, by providing legal advice on compliance requirements based on national and state territory health and community services legislation. So refer issues relating to rights and responsibilities. Employees, employers, and clients all have rights and responsibilities. stated in international treaties and implemented through national laws. Rights are entitlements that belong to every person in a group for which the rights are written. These rights come with responsibilities, which ensure that they exercise these rights in a way that does not step on the rights of others. Issues arise when such rights and responsibilities are not achieved within and outside the service. So below are the rights and responsibilities of employees, employers, and clients. So rights and responsibilities of employees and employers. The international organisation that handles issues related to labour is the International Labour Organization, otherwise known as ILO. The ILO is an agency under the United Nations. They set guidelines that promote labour standards, including the rights of workers and employers. The core standards set by the ILO in the Declaration of Fundamental Principles and Rights at Work include provisions on freedom of association, collective bargaining, forced or compulsory labour, work quality, and protecting of child workers. Rights and responsibilities of clients. Your clients in your line of work are people of different ages and races. The rights of your clients root in international human rights treaties. So contained in this table is both relevant Australian legislation and human rights treaties. You should familiarise yourself with these. You'll find more information about this in your learning module. Referring issues impacting on achievement of employee, employer, and or clients' rights and responsibilities. Other people in your organisation can help you address these. They are employees, your director supervisor, HR officer, Australian Human Rights Commission, and Fair Work Ombudsman. Various issues may impact the achievement of rights and responsibilities. Such problems occur when the employee, employer, or client's rights and responsibilities mentioned in the previous are not achieved. Just like breaches and adverse events, issues must also be referred to the appropriate people. When you are faced with the problems, you may impact the achievement of rights and responsibilities. You may consult with other employees, managers, supervisors, or compliance officers. Refer unresolved conflicts. So unresolved conflicts refer to conflicts that cannot be handled anymore within the service. These conflicts may be about clients, work roles, disagreements, or challenges with other relevant people. Unresolved conflicts must be referred to the supervisor, otherwise they are likely to worsen. This may affect not just the service, but as well as its members and other relevant people. Conflicts need to be resolved immediately. However, there are instances when there are unresolved conflicts. These conflicts must be cascaded and discussed with the supervisor. This is important for the service and its members not to be affected by such unresolved disputes. Some of the possibilities of unresolved conflicts could be the number of complaints may increase, lapses in communication may worsen, deadlines may be delayed or missed, employee turnover may increase, collaboration may be reduced, members may become unmotivated, clients may stop subscribing to services, and work culture may become toxic. So these possibilities may be avoided when the supervisor is aware of the conflicts in the workplace. The supervisor can help by doing the following: considering the client's suggestions and recommendations for the service, arranging meetings for the members to settle their disagreements, listening to each of the members' concerns and issues, taking immediate action, implementing necessary programs, and thinking of new strategies and techniques. Referring to the supervisor, this means to mention or discuss the necessary information with the supervisor. This involves explaining what happened and the reasons behind the conflict. Referring unresolved disputes to the supervisor may help in preventing these conflicts from worsening. An example is procedure on how unresolved conflicts can be referred to the supervisor. You need to check your supervisor's availability. Then schedule a meeting with them. Involve other people who may help discuss unresolved conflicts. Prepare the necessary information, documents, or evidence they may help you in the discussion. During this discussion, present your slide calmly and respectfully. What have we learned? In this part of the session, we have covered communicate effectively with people, collaborate with colleagues, address constraints to communication, and reporting conflicts. In the next webinar, we'll be discussing accomplishing workplace correspondence and documentation and contributing to continuous improvement. Thank you for your time, and with the information you have learned today, you should be in a good position to handle conflict situations respectfully and professionally. Thank you.